I was a bit fearful because I didn't know what was wrong, and like he said, he just wasn't feeling well, and I thought maybe we'd go there, they'd diagnose something, give him a prescription, we'd get it filled, and he'd go home. But then when he had to stay, that it kind of made me a little bit nervous because of the unknown.
But I can still remember going into the emergency room, honestly scared to death.
In emergency nursing and medicine, you understand that the specialty is a devotion for your lifetime, and that you hope that you are the best part of someone's worst day.
He was in pain and he needed somebody. They were there right away to check on him and see what was going on.
No one knows when they're going to need these services. We are essential and critical to the mission of the medical center and for our community.
Today we embark on the largest initiative ever undertaken by the medical center, a $128 million vision to transform our facilities into the healing environment our patients, families, physicians, and staff deserve.
We have very time-sensitive diagnoses now, and so, for instance, patients who come in with chest pain, we have 5 minutes to get an electrocardiogram completed. At the current time, we have space to do one at a time. In terms of the ambulance bays, we actually have community ambulances that cannot back into our bays because they're too big. Our ambulance garage is too small, and so those are some of the ways in which our care has been affected. This emergency department was last renovated in 1999 and was built for around 20,000 patients. I believe we're seeing between 25 and 26,000 patients right now.
Captain Wallace Greeley made a profound impact on Central Iowa. His vision for a regional medical center back in 1916 has lived on for nearly 100 years in the hospital he named in memory of his wife, Mary. Today we have our own extraordinary vision, a vision that will transform our facilities to meet the needs of our patients, visitors, physicians, and staff now and well into the future. A vision that will aid us in creating the healing environment our patients and families deserve.
The current rooms were built greater than 40 years ago and are clearly outdated. And they need to be updated so they're more patient-friendly, they're more patient-family-friendly, and also for the staff and physicians to deliver care. As a healthcare provider and physician at Mary Greeley Medical Center, what I see is one of the great benefits of this project is that it's going to improve quality of care. The physical improvement of the patient-sized rooms, the expansion of the emergency room services are going to assist the staff and the physicians in their delivery of care. It's going to be much more patient-friendly. There's going to be efficiencies built into the system, and I think that it would make all the medical staff's jobs considerably improved and easier to deliver and continue to deliver that quality of care that's offered at Mary Greeley Medical Center.
Our new, more generously sized patient rooms will feature distinct areas for our patients, visitors, and staff. The larger restrooms will offer additional safety measures, including a zero-threshold shower to make it easier for our patients who might be challenged with mobility. We will create an enhanced main entrance with a covered skywalk from the parking garage. Our healing environment will include rooftop gardens and other outdoor spaces. The overall facility infrastructure will be strengthened with a new power plant, incorporating new, more energy-efficient systems to provide for current and future needs. We'll expand the capacity of our emergency department and modernize it along the way, including the construction of a new drive-through ambulance garage. This is by far the most significant undertaking in our 100-year history. It's challenging, but it's also what is necessary to maintain and improve our level of patient care. And with over 130 physicians providing an ever-expanding array of specialties, we are well positioned to serve the growing demands of Central Iowans and to keep that care conveniently located close to home.
When you get a phone call that your child is in the emergency room, it catches you off guard. And so your heart races, and but when I walked into that room, she was sitting there calmly. I could see that the staff had already been at her side, and she had no reason to worry. And from the minute I talked to even the registration staff, it was very calm. They got us immediately back to a room. Morgan was, you could tell she was very at ease with all the staff. They did everything they could to be gentle and to educate her before they touched her. They just made sure that she was aware of everything that they were going to do. And so when you see people treating your child with that gentleness and that respect, it makes you feel secure and safe and know that they're in good hands.
The level of care, the attention to detail, the part about not making me fearful of the unknown, because at that time there was no diagnosis. But they just made it appear that you're going to be okay. You know, just let us take care of you. Let us go through this with you. We're going to be here, and there'll be somebody with you every step of the way.
It makes me feel very comfortable to know that Mary Greeley Medical Center is in our backyard and that we can go there to seek care for our family, whether it be for surgical care or the emergency room visits, which we've done on several occasions.
To make this extraordinary vision a reality, we need your help.
The quality of care obviously is important to a patient when you come to Mary Greeley Medical Center. And I've been here several times, and I can't say enough about how well they take care of their patients. But with the addition we're talking about, it will provide even better care than we've had in the past, and it's extremely important that we make this happen.
We have to grow with the times to meet the needs of the community.
As we recruit young professional people that are very talented, this project is so important that we position ourselves to recruit those individuals.
As an Ames native and as an employee of Mary Greeley Medical Center, I am very proud to be able to participate in the campaign to support this new facility that we're building. It's exciting, it's cutting edge, and I always love being part of that.
When we needed it, it was there. And so for us, it's our turn. You know, it's our turn to make sure that the future generation of residents of this community have enhanced care facilities.
This vision that Mary Greeley Medical Center has to improve its facilities is important to all of us who live in Ames and the surrounding areas for the simple reason that we all will need medical care sometime in our lives. And we would like to have you help in making this become a reality.
Mary Greeley, important to us and important to you. Do come and join us with this effort.
If this extraordinary vision for the future of Mary Greeley Medical Center resonates with you, we need your help. Please thoughtfully consider a meaningful gift to our Extraordinary Visions campaign.